Wheelchair user Adam Gabsy was diagnosed with multiple sclerosis 10 years ago at the age of just 21. His life depends on the NHS. But cuts to services have had devastating impacts, and as the general election looms, he doesn't have much hope it will get any better, whoever wins.
But it's on its knees because we had 14 years of austerity, followed by potentially more austerity, regardless of whatever party gets in charge, because I haven't heard anything that fills me with confidence that things are going to change. I've been on a waiting list for nearly 2 years now for a treatment, and it's just been cancelled and it's been pushed back. So it has affected me personally, unfortunately.
Britain's NHS horror stories are not new, with waiting times at an all-time high, operations and appointment cancellations soaring, and care being delivered in corridors due to a lack of hospital beds. It's no wonder the NHS is a big issue facing voters, and as Brits head to the polls, it's got the two main rivals at loggerheads.
The waiting lists are coming down.
The waiting list is 7.2 million, they're now 7.5 million. He says they're coming down, and this is the guy who says he's good at maths.
Yeah, they are now coming down.
Whoever wins the election, the challenges are clear. Once one of Britain's favourite institutions, satisfaction with the NHS is at its lowest in 40 years. So what's going so wrong?
Through a series of legal changes, the NHS has been effectively repurposed. So in 2012, for example, the duty of the Secretary of State to provide healthcare was removed and replaced with a duty to promote. So the legal standing of the NHS was abolished. So the NHS, the logo remains, but nothing else of the NHS ethos is intact. The impacts on patients are catastrophic.
Currently, there are an estimated 53,000 private contracts within the NHS, worth around $37 billion a year. That's about a fifth of the entire health service budget. Over 2 million NHS patients were treated by private companies, just short of 10% of all treatments in 2022, which is up from around 3% in 2011. According to studies, the privatisation of NHS care has coincided with a decline in quality, and it's patients like Adam that are bearing the brunt.
Well, the current state of the NHS is really bad, and I'm not full of confidence that it's going to improve. The waiting times are ridiculous, and I can't see how that can improve without serious investment, a serious thought and care going into it.
The NHS has emerged as a key battleground in the general election. All parties are promising more money, but will it be anywhere close to what's needed to pick the NHS up from its knees? Shadia Edwards-Dashti, TRT World, London.